Assalamu alaikum students. Today I will teach you about the anatomy of reproductive system, mainly its external organs, the female anatomy of reproductive system. Introduction. The reproductive organ in female are those which are concerned with copulation, fertilization, growth and development of fetus and its subsequent exit to the outer world. The word copulation means the sexual intercourse or the sexual behavior in which a male introduces sperms into the female's body, especially directly into her reproductive tract for fertilization. Okay. The female reproductive organs can be subdivided into external genitalia, internal genitalia, and the accessory reproductive organs. Today I will teach you about the external genitalia. Although the function of the female reproductive system are it mainly produce sex hormones which are the estrogen and progesterone. Another function of the reproductive system is the production of egg, which is mainly ova, for fertilization, which is used for the fertilization of fetus. Another main important function of the reproductive system of female are the support and protect developing embryo, and another one is that it give birth to a new baby. Labia majora. Labia majora is that area. Okay. Labia majora referred to as the outer lips. They have a darker pigmentation. The labia majora protects the introitus and the urethral opening. What is the introitus? इंट्रोइटस इज एनी टाइप ऑफ एंट्रेंस और ओपनिंग इंट्रोइटस कोई भी तरह की एंट्रेंस या ओपनिंग होती है द टर्म ऑफन रेफर्स टू द ओपनिंग ऑफ वजाइना ओपनिंग ऑफ वजाइना जो एरिया होता है उसे इंट्रोइटस कहते हैं विच लीड्स टू द वेजाइनल कैनाल जो वेजाइना से होता हुआ वेजाइनल कैनाल तक लेकर जाता है ओके वेजाइनल इंट्रोइटस उसे कहा जाता है ठीक है तो ये प्रोटेक्ट करता है वेजाइनल कैनाल को एंड वेजाइना को लेबिया मेजोरा प्रोटेक्ट्स द वेजाइनल कैनाल एंड वेजाइना एंड यूरिथ्रल ओपनिंग्स को प्रोटेक्ट करता है are covered with hair and sebaceous glands tend to be smooth moist and hairless. The labia majora contains sweat and oil secreting glands become flaccid with age and after childbirth. Next one is the labia minora. Labia minora is referred to as the inner lips made up of erectile connective tissue that darkens and swells during sexual arousal. Located inside the labia majora. They are more sensitive and responsive to touch than the labia majora. The labia minora tightens during intercourse. Next one is clitoris. Clitoris is a highly sensitive organ composed of nerves, blood vessels, and erectile tissue. It is made up of a shaft and glands. Clitoris is made up of shaft and glands, becomes engorged with blood during sexual stimulation. Key to sexual pleasure for most women, and the urethral opening is located directly below the clitoris. Clitoris is the area of high bundle of nerves and a bundle of blood vessels and erectile tissue. Okay. नेक्स्ट वन इज द वेजाइनल ओपनिंग इंट्रोइटियस आई मैंने आपको पहले भी बताया कि जो वेजाइनल ओपनिंग होती है जो प्रोटेक्ट करता है वेजाइनल ओपनिंग को एंड वेजाइना को उसे इंट्रोइटस कहते हैं ओपनिंग में बी कवर्ड बाय थिन शीट कॉल्ड द हाइमन using the presence of an intact hymen for determining virginity is erroneous because some women are born without hymens. The hymen can be perforated by many different events and can be torn up. Like hymen can be torn by any activity like horse riding, like any physical activity, any gaming positions. Like hymen is totally perforated. Next one is perineum, the muscle and tissue located between the vaginal opening and the anal canal. It supports and surrounds the lower parts of the urinary and digestive tracts. The perineum contains an abundance of nerve endings that make it sensitive to touch. An episiotomy is an incision of the perineum used during childbirth for widening the vaginal opening. Like childbirth में perineum को थोड़ा सा incision की जाती है, like कट लगाया जाता है ताकि बेबी की बर्थ हो सके वाइडन करने के लिए. देन उसे स्टिचिंग कर दी जाती है, तो वो एरिया जिस पर स्टिचिंग की जाती है उसे पेरिनियम कहते हैं. Another the accessory organs are the breast. आपको मैं इंटरनल जेनिटेलिया जो है वो नेक्स्ट लेक्चर में पढ़ाऊंगी. आज मैं आपको पढ़ाऊंगी इंटरनल एक्सटर्नल जेनिटेलिया एंड द accessory organs. Another accessory organ is the breast. The breast or mammary glands are accessory glands of the female reproductive system. They exist also in the male but in only a rudimentary form. Like it is present in male but in rudimentary form. Structure: the mammary glands or breast consist of varying amounts of glandular tissue responsible for milk production. Each breast contains about 20 lobes, each of which contains a number of glandular structures called lobules where milk is produced. Lobules open into lactiferous ducts which drain milk towards the nipple, and the breast itself is covered in subcutaneous fat. In the lactating breast, glandular tissue proliferates hyperplasia to support milk production and recedes against after lactation stops. Like जब lactation period मदर का आता है during childbirth में, तो जो ब्रेस्ट होता है उसमें हाइपरप्लेजिया हो जाता है. लाइक मैक्सिमम नंबर ऑफ सेल्स बनना प्रोड्यूस हो जाते हैं, एबनॉर्मली सेल्स बनना शुरू हो जाते हैं, जिसकी वजह से मिल्क की प्रोडक्शन होता है. ठीक है. एंड देन आफ्टर सम टाइम द लैक्टेशन स्टॉप्स बिकॉज द हाइपरप्लेजिया इज रिकवर्ड. हाइपरप्लेजिया एक नॉर्मल फिजियोलॉजिकल प्रोसेस है जो अगर नॉर्मल अमाउंट में हो तो वो हमारे लिए बेस्ट है, लेकिन अगर वो एबनॉर्मल अमाउंट में हो तो वो हमें डिजीज़ कॉज करता है. ठीक है. तो हाइपरप्लेजिया इस केस में नॉर्मल अमाउंट में, इसी वजह से क्योंकि नॉर्मल अमाउंट में ये मिल्क की प्रोडक्शन करता है, जब ये नॉर्मल फिजियोलॉजिकल पोजीशन पे पहुंच जाता है तो ये लैक्टेशन को स्टॉप कर देता है. Then the nipple. This is a small conical eminence at the center of the breast surrounded by pigmented area, the areola. On the surface of the areola are numerous sebaceous glands which lubricate the nipple during lactation. The sebaceous gland is also known as monogamy tubercles. Thank you so much.